So today we had a new patient that came in with a lot of pain on left anterior thigh, and it was coming from the lower back. He initially felt it in the back on Sunday, which was about 4 days ago, and came in today. We performed an adjustment at his L5, did full spine x-rays, and decided not to schedule the patient back because I think we got the resolution, and I told him to call if the pain persists, and we'll check on it if it does. And if it doesn't, we'll just follow up with him when he calls us. So the point being, it's not about how many visits you see a patient. Sometimes if you're doing the right adjustment, instantly the pressure comes off and the nerve function gets restored. And the best thing you can do at times is to leave it alone. All right, so we'll go through the video today, the entire video and the entire visit, so you can actually see how it's done. Thanks.
This is where I feel the most pain, right now. It's right here, and then when I sit down, it's
Right, so I can see you have pain on this right side.
Yeah.
Okay, so follow me. So this one's a little tricky. You can leave your hat over there, glasses over there. So you've probably never been on one of these. This is the Gonstead knee chest stable. So we're going to use your own body weight. You're going to kneel down, knees are going to be here, faces here. You're going to grab the sides, and you're going to let that stomach drop. So I'll guide you. Okay, and bring your head right here. That's good. All right. Okay, so let's see if we can even use this table. So see if you can slowly let the stomach drop. If you can't, that's okay. We're not going to force it, but let's see if we can, because if we can, you'll get the best adjustment on this table rather than anything else. So now I want to touch this bone right in here. Let me know if that's sore, yes or no. The one above it, is that sore?
Yeah.
Yes. How about this one? Not as bad. This one, not as bad. This one, not as bad. This one, not as bad. And this one, not as bad. Mainly right in here. Am I right? Number 5. Is this getting better?
Yep.
Easier? Okay. So let's allow the stomach to go down more. Okay. Okay, I'm going to give it a push this way. Try not to resist, okay? Okay, did you feel that?
Oh, yeah.
Did you feel the pop?
Uh-huh.
Okay, good. I'm going to let go slowly. All right, now you can get up using your knees mainly, and we're going to go for a walk on the hallway. I want to see if it's easier to walk. So go ahead all the way. I want to see how you're walking. Oh, you're actually walking normal now. All right. Is it easier to walk?
Night and day.
Yeah, you're not tapping that foot, you're not shifted, you're not, so yeah, so the pressure was right there on that L5 on the right side. And I had to set it forward and close the wedge on the right. So let's go back to this room. I'm going to also adjust your upper back because you got a little pressure here. And I'm also going to set this because all of this is connected. So we're going to go on that table in the front. go ahead and put your face in there. Good. And let's grab here. It's going down slowly. You feel the pain right in here?
A little bit. Yeah.
That's very painful, right?
Uh-huh.
All right, relax your stomach, relax your shoulders. In fact, put your hands on the floor. That was a good movement. All right. Now, let's have you sit right here. I'm also going to set your neck because you never crack your own neck, right?
Yeah, I do once in a while.
Okay. So
I still feel just a slight.
you have to let it, because usually the pressure comes off from here first, right? Now this area is not next to the back, it's a little further. So this will come off next. It might take a day or two, but this will come off. Now, if your pressure was on your foot, that would take a couple of days because it's far from the back, right? Because there's inflammation on that nerve. The inflammation is going to go down slowly within a day or two. But first, the pressure comes off from the back. And that should be instant. So. So we have degeneration and fixation at the lower neck, so right around here. It has reversed from C5 to the opposite. Here's 5. We're going to work on 6, which is down here. Do you feel that pressure at 6?
Yeah.
Okay. So let's see if you can lean this way or this way. Yeah. So since you pop your neck, it's not as easy to adjust it, and I'll tell you why later. But you're going to notice that I will not twist your neck. I'm just going to slightly lean it and set it. Woo! That was awesome. But imagine if things are clogged up from here going all the way down, so it can affect the lower part as well. So that pressure came off. A couple of days until this pain comes off, because the pain is gone from the low back.
Yeah.
There's no pain there now. So this will come off. Again, be patient until today's, probably by Friday, that should be gone. But you got to hold this adjustment. So let's have you tilt your hips forward like this. So you want to tilt your hips forward. There you go. So that way you get the arch in there. So when you're sitting, you want to be centered. So right now your ear is over the shoulder, over the hips. That's how you got to be. You got to be centered. If you slouch like this can come out again. So we want to make sure that the back is straight. Yeah. And that's what usually happens. All right, so let's leave it alone. I'll follow up with you if I need to. So keep an eye on it. If you feel like the pain is not 100%, I'll do it one more time. If you feel the pain is clear, that means I'll see you when the pain comes back.
I like your style.
You know what I mean?
Yeah.
So I don't like to say, okay, come back, because we don't know what's going to happen.
Mm-hmm.
But I feel pretty confident today that we did very good.
Oh yeah.
Yeah. All right, any questions?
No.
Okay, don't lose my adjustment.
Okay.
Keep that back arched. So when you want to lean, just lean this way. The next 7 days are important. Don't try to bend and twist. Just feel like your back is in a brace. You want to sit, you sit straight. So until the pressure comes down. And then
So,
after that, you can do things easier.
Is it okay to go back to work or no?
Yeah.
Yeah?
Yeah, go back to work.
Okay.
Yeah. What do you do?
I'm a longshoreman. I'm a mechanic down at the harbor.
Yeah. Yeah, go back to work.
Okay.
Yeah, just don't bend too much. Now, as a mechanic, you're probably bending a lot, right? Just try to bend with your hips rather than with your back.
Okay.
See, there's a difference.
Yes.
Use your hips mainly. So brace that back. Make sure you're making this area tight. So bend with your hips.
Okay.
Make sense?
Yes.
Okay. All right.
Great. Thank you. Appreciate it.
You're welcome.